A lot of people are worrying about coronavirus.
Things you should know about coronavirus.
Good news is you can protect yourself, and the NHS says you should do these things, even if you're not likely to.
Number 1, wash your hands more. So if you've been out in a public place, on a bus or a train, wash your hands as soon as you can afterwards.
So that takes about 20 seconds to get them really clean, focusing on all parts of your hand, not just your palm,
Backs of hands,
around the nails, in between the fingers,
wrists,
and your thumb, and use soap and water.
and when you're done, turn the tap off using a tissue and put it in the bin.
Antibacterial gels do work, but soap and water is best.
Number 2, avoid touching your eyes, nose and mouth, because that's the way the virus could get into your body. You can still touch your face, but only if you've washed your hands before. Number 3, catching your coughs and sneezes.
Experts think coronavirus is spread by droplets that come out of your nose and mouth. So when you sneeze or cough, catch them with disposable tissues, then bin it. Disposable tissues are better than handkerchiefs that you carry around with you all the time. If you don't have a tissue, sneeze or cough into the crook of your elbow.
That way the germs are away from your hands. Don't touch things with your hands if you don't have to. The less you touch things like surfaces, handrails, lift buttons. Number 4, stay away from people who are ill.
And when it comes to travelling, check with the Foreign Office before you plan to go.
And these things won't work when it comes to treating coronavirus. UV light,
Antibiotics
garlic.
and saline solution. As for masks, they're important when people are in very close contact with patients, but there's very little evidence that masks are helpful in everyday life.